Which are the foods to take if you have hypothyroidism? One is carrot beet juice, which consists of a mixture of carrots and beetroot. This helps to detoxify the body, which is necessary for hypothyroidism. You can take whole grain bread and brown rice. It is good to take dairy products like milk, curd and yogurt. Zinc-rich foods such as chicken, beef are good for hypothyroidism. Also, you can take lemons which contain vitamin C. Apple cider vinegar is good for this disease because it boosts metabolism and weight loss. You can take fruits like grapes, kiwis and cranberries. Fish, eggs and meat are also good for hypothyroidism. You can take vitamin D rich foods such as crab, shellfish, Brazil nuts, kidney, liver and shiitake mushrooms. These foods contain selenium also, which help for the conversion of T4 to T3. You can take fish liver oil or omega-3 fatty acid tablets. Fishes like shrimp, cod, tuna, salmon and halibut are good for hypothyroidism. Fruits like pineapple juice is very good for hypothyroidism because it activates the thyroid gland. You can take roasted seaweeds. Tyrosine based foods such as almonds, sesame seeds and gluten-free oatmeal is good for hypothyroidism. Fruits like papaya, watermelons, pumpkin seeds which contain iron is also necessary for hypothyroidism. You can take turmeric for hypothyroidism because of its anti-inflammatory properties. Vitamin D supplementation is necessary because it can prevent Hashimoto's thyroiditis, which in turn can be a cause for hypothyroidism. Now, which are the foods to avoid for hypothyroidism? You should avoid caffeine-containing foods such as coffee and chocolate. It is necessary to avoid cabbage, cauliflower, broccoli, kale, spinach, Brussels sprouts, and also potato and tapioca. You should avoid fruits such as peaches and strawberries. Soy foods such as soya bean are to be avoided. Also, millets, peanuts, peanut butter and pine nuts are not to be taken. Sugars and excess of carbohydrate-rich foods are to be avoided. How we can prevent hypothyroidism? Vitamin D supplementation is necessary for preventing hypothyroidism. Low levels of vitamin D can cause Hashimoto's thyroiditis, which can cause hypothyroidism in the person. Regular exercise is necessary, which include walking, hiking, running, swimming or working out in a gym. Mental stress can lead to hypothyroidism, so try to reduce the mental stress by involving in pleasurable activities, hobbies, games and sports. What are the lab investigations for hypothyroidism? One is blood test. Here you can check TSH, that is thyroid stimulating hormone. The normal value of TSH is 0.4 to 4 milli international units per liter. Another test is T4, that is thyroxine hormone. The normal level of T4 is 5 to 12 micrograms per deciliter. Another test is T3 test, that is triiodothyronine hormone. The normal value of T3 is 75 to 195 nanograms per deciliter. Also, we can check free T4, that is free amount of thyroxine hormone. The normal value of free T4 is 0.9 to 2.3 nanograms per deciliter. Another is free T3 test, that is the free amount of triiodothyronine hormone. The normal value of free T3 is 0.2 to 0.5 nanograms per deciliter. You can also check hypothyroidism by ultrasound scan of thyroid gland. There are two types of hypothyroidism. One is subclinical hypothyroidism. Next is primary hypothyroidism. In both these, the blood test varies. In subclinical hypothyroidism, the level of TSH will be high. The levels of T3, T4, free T3 and free T4 will be normal. In primary hypothyroidism, the level of TSH will be high, but the levels of T3, T4, free T3 and free T4 will be abnormally low. You can also check anti-TPO antibodies in the blood test, that is thyroid peroxidase antibodies. This will detect whether you have Hashimoto's thyroiditis, which can cause hypothyroidism. The normal value of anti-TPO antibodies is less than 35 international units per milliliter. Now, homeopathy. There are efficient homeopathic remedies for hypothyroidism. Intake of homeopathic medicines will help to regulate the TSH, T3 and T4 hormones in your body. This will help to alleviate the symptoms of hypothyroidism, resulting in a complete cure. So far, we have discussed about hypothyroidism. Hope you have understood the topic. However, if any further queries or clarifications are needed, you can add in the comment box or drop a mail. Accordingly, we can discuss in the upcoming sessions.